Hey folks, Doug Blake with Body Design University. In today's video, I want to talk to you about tendinitis and in particular about the issues that occur at the elbow. So tendinitis, just as a very general, broad definition, by the way, just put the word, the suffix itis, I-T-I-S, generally at the end of a body structure like a tendon, or I don't think there's anything known as ligament titus, right? Never heard of that. But tendinitis simply means inflammation to the tendons. Generally, what we talk about in personal fitness training are those areas of the body, those joints of the body, generally the kinetic chain checkpoints that we call them, such as the elbow, the neck, the LPHC, lumbo-pelvic hip complex, the knee and the ankle, the wrist, for instance, even the fingers can obviously get inflammation in the particular intrinsic muscle tendons located in there. But generally, and I'm talking very generally, now I've seen tendinitis, and that's, by the way, that is a diagnosed condition. Stay in your lane, trainers. Stay in your lane. Don't be telling somebody they got tendinitis or elbow tendinitis or tennis. Now, you can use the term tennis elbow. You can use the word golfer's elbow, I guess. But even then, I'd be very, very careful because the term, and you got to put it in quotes, tennis elbow simply describes the condition that a physician would determine as lateral epicondylitis, or in the case of what we call golfer's elbow on the inside of the elbow, right, medial epicondylitis. So why do we say that? Because as a trainer, you got to stay within your scope of practice. You can't be telling people they have some sort of pathological condition, some sort of musculoskeletal condition when you're not a doctor. So what we will normally do is make reference to the pain and the inflammation normally associated with this diagnosed condition. Okay, so what is it? It's basically when a tendon, for whatever reason, now it could be because you play tennis and your technique is wrong, right? Movement of the wrist. If you ever go to like a tennis technique type seminars, one of the first things they're always going to tell you, especially as a beginner, is not to flex or extend the wrist. So if you look at my wrist, okay, you can see this extension at the wrist in the sagittal, right? Flexion and extension is in the sagittal plane. Extension of the wrist is moving the fingers up. Flexion of the wrist is moving the palm or fingers down. Don't confuse this with finger flexion. That's what I call it. So flexion of the digits, right? Digital flexion. Finger flexion is this. Wrist flexion, let me see if I can get a better view for you. Wrist flexion is this. Okay, so making a fist and pulling down this way will allow you to perform flexion and extension, right? So that's all it is. So the muscles responsible for those two movements, the extensor muscles, right, and the flexors, wrist flexor muscles, those muscles ride up and down all along your forearm, right? So I got my fingers, I've got my wrist, I got my forearm, right? The ulnar and the radius bones, right? And then I got my elbow. The muscles that lift, I don't know if you can see that, but you can kind of see these guys up in here, the muscles that lift the hand off the table or extend the wrist, those muscles are located all along the forearm, and they essentially end, okay, technically this is the origin, believe it or not, and that's the distal end of the muscle, but the muscles themselves insert into what are known as, we use the term epicondyles. It's a big fancy term for saying a bony protrusion that allows for better biomechanics for the particular muscle and how it functions and works over that joint. So you have what's known as a lateral epicondyle. And then if I move my wrist over this way on the inside of the elbow, and by the way, you can feel it. That's what your funny bone is. So this is the medial, well, the funny bone is actually the elbow itself, but this is what's known as the medial, right? Internal epicondyle. So the terms are not as critically important as you may think, But the fact of the matter is that tendinitis is basically an inflammation of those tendons that connect into both the lateral and the medial epicondyles at the elbow. That's what's causing the pain and discomfort. These are not the largest, thickest, most powerful muscles of the body. The tendons are not thick and powerful, right? That connect these muscles to the bone. So those tendons can easily get inflamed by doing what I do all day, which is I'm on the computer and I'm doing this, and what will end up happening is that there'll be an inflammatory response to the overuse of these particular muscles. The reason they were termed both tennis elbow, and golfer's elbow is because of the swing mechanics associated with those two sports. And it kind of makes sense because anytime I'm causing overworking of the muscles through wrist extension, like if you take how many of y'all play tennis? You know what I'm talking about if you play tennis, right? You ever heard you got to keep those your wrist and your hands straight. So when you're holding the tennis racket, here I am giving you tennis lessons. So when you're holding the tennis racket, you don't want any movement of the wrist this way. It's one of the hallmarks of top level tennis pros is their ability to maintain that straight lack of movement in the wrist at all when they're doing like a backhand, and their forehand as well. So technically, when you do like a backhand swing in tennis, you're generally going to, like if you're an amateur like I am, you're going to flick the wrist simultaneously. You're going to move the racket up and back, which should occur at the shoulder and the elbow itself, but not at the wrist. When you extend and do this over and over, and there's other ways to overwork those muscles. I'm just saying, hence the name tennis elbow. When you do that over and over and over, these guys right here, these tendons that attach those muscles that are working, right? Those guys right there get inflamed and it hurts. Okay. It's the same thing when we talk about what has been termed golfer's elbow, which is the opposite. Now imagine playing golf. Same thing, right? You don't want any excessive movement at the wrist when you're swinging a golf club. So the idea with the golf club is that you will tend to, on your swing, tend to flex the wrist forward. Any golfer out there, you know what I'm talking about, and stop it, because you're going to cause tendinitis on the inside of the elbow, medial epicondylitis, it's known as, right? It's just inflammation of those tendons because you have flexor muscles, right? The muscles that flex the wrist, right? This way, and those muscles are located on the inside medial aspect of the forearm. Those muscles, those particular muscles that we're talking about, insert into that bony protrusion known as the medial epicondyle, and they get inflamed and they hurt. Okay, you're a trainer. What do you do? Well, therein lies the sort of the trick in dealing with individuals with elbow tendinitis, either lateral or medial. And that is to ensure that the client, when they are doing particular movements related to the biceps and the triceps, right, in particular, the standard go-to workaround for that is not to tell them they have tennis elbow lateral epicondylitis, but it's to simply, when they are doing a particular movement and it bothers them and hurts, is to simply change the mechanics of the wrist position. See how easy that is. But there's also another trick that you've got to keep in. I say trick, but it's more like a tip, right? A workaround, exercise workaround. That is to make these modifications to the wrist position to go from pronated to neutrally pronated, or neutrally pronated to supinated. Sometimes, depending on what the actual cause of the pain is, whether it's the lateral or the medial, a supinated position for dumbbell curls, for instance, might be excruciatingly painful, like it is for me in my right elbow. It hurts a lot, so I can't do that. So I'm able to actually go into a neutral grip, or what we call a hammer curl. Takes the pain away almost 100%. So that's what I'll do. In some cases, that is not a good fix. So this is where you, as the trainer, you've got to be, a problem solver. That's what a workaround is a basic problem solving mentality. When you are doing pulley rows, trust me, every exercise that involves flexion and extension at the elbow, if you have any of these conditions, these tendinitis conditions, there's going to be pain and discomfort. Okay. If after you warm the individual up, if after you've done some very light movements before you actually start working a little bit more intense, if after that does not take the pain away, because quite often just warming up the area will actually alleviate a lot of the discomfort. But if the discomfort remains, you have to do the workaround. And like I say, one of those is very simple, going from a supinated position to a neutrally pronated position. You see if that works. Now, here's the other tip, and I have found this to be very, very effective when you're doing movements that in particular involve training the back, so rows. And it's the positioning of the elbow, right? We don't often look at elbow positioning when we're doing particular movements because we're thinking that we have to do the proper technique. Proper technique is what it is. Proper technique means that you are working effectively biomechanically the muscles that are in question, so your target muscle. But here's the thing, if I'm doing everything perfect and correct according to the magazine that I'm reading or some competitive athlete that says this is how you do it, if I do that and it hurts my elbow, then it's not correct. Now, it might be biomechanically correct for the robot human that we use as a standard for proper exercise technique, but not for that particular client. This is where workarounds come in. And elbow positioning is one of the most effective ways to mitigate the pain and discomfort associated with tendinitis. So just keep that in mind when you're doing rowing movements, one-arm rowing movements, anything that involves the flexion and extension at the elbow. Look, even tricep exercises, even bench pressing can have some painful after effects, or while you're even doing the exercise on the elbow due to those two types of inflammatory conditions known as tendinitis. So first off, elbow position for sure. That's generally the go-to, the primary way that I can make modifications that generally will alleviate the pain and discomfort. And then the second is the position of the elbow. The terms that we use are abduction and adduction, shoulder abduction, shoulder adduction. Essentially what you're doing is you're changing the angle of position, that angle of abduction, adduction at the shoulder by being at 180 degrees, right? Let me make this easier for you. Here we go. So 180 degrees to 0 degrees, however you want to say it. So fully adducted in full adduction versus abduction. And what I'm saying is that you need to make minor modifications to the level or the position degree of abduction. You've heard the ideal position for training your back, probably, and it's not correct, is to keep your elbows tucked in tight and pull all right this way and pull. No, there's no perfect, correct way to do it. Everybody's biomechanics, their body is unique, and therefore you have to always make modifications based on how you feel it in the muscle, not necessarily what it looks like from the outside. And what's happening in the skeletal system. So the tip here, when you have these issues in the elbow, is to make modifications. In general, what I have found is that abducting slightly, moving the elbow away from the body when you're doing a rowing exercise, for instance, changing the position of supination, pronation at the wrist simultaneously when they're doing when your client is doing a rowing exercise, for instance. I'm just going to show you with one arm. This hurts, and they feel it on the inside of their elbow. Just as a for instance, they do this, one minor little adjustment out this way. Are they still training their lats? Of course they're training their lats. That's ridiculous. You're training your lats when you do it in a fully abducted position. Of course you're training your lats, not effectively, but you're still training them. So we make these slight modifications to the biomechanics of the movement, and that should then hopefully take away or alleviate the pain. So remember, tendinitis, inflammation, itis at the end of a structure like a tendon means inflammation, damage, however you want to say it, to that particular structure of the body. Tendinitis is the inflammatory response associated with generally overuse, overworking the muscles that the tendons are attached to, and those tendons then get inflamed and they become painful. Obviously, it could be painful all the time, or it could just be painful when you're doing particular movements. And so there's the lateral epicondylitis, right? So that is tendinitis on the extensor muscles of the wrist. And then there's medial epicondylitis, which is caused by inflammation of those tendons from the flexor muscles of the wrist, not the fingers and not the finger extensors and finger flexors, but the wrist itself. Okay. Look, at the end of the day, your client needs to do something to alleviate the condition itself. I always recommend they go see their doctor, and because let the doctor take on the mantle of responsibility for helping them solve the problem. My job as a trainer, your job as a trainer, is not to heal them. Your job as a trainer is, while they are under medical supervision, however they're doing it, your job is to make sure it doesn't hurt while they're training, using the science of biomechanics, kinesiology, and in some cases, just common sense. If it hurts, don't do it. If you got to reduce the range of motion, reduce the range of motion, because that could be a big part of the problem. Their doctor is trying to help them by giving them some pain meds, whatever the case is, and you're blasting their elbow by extending all the way down this way. Well, that's not helping the condition. So keep that in mind. Look, if this was helpful, type the word understood in the little comment section below. Remember, if you want to be a certified personal trainer, go ahead and click on the in the comment, well, not in the comment box, but in that description box. You know what I'm talking about, right? There's a little link in there, right, in the description box. And just let us know how we can be of assistance. Every Wednesday night, just so you know this, every Wednesday night, 6 o'clock Eastern Standard Time, 5 Central, 4 Mountain, 3 Pacific, okay? Every Wednesday night, we do what's known as Quizlet Live. It's an exam study. It allows you to work on and develop your memorization skills so you can pass the necessary exams that are associated with getting certified as a personal fitness trainer. So remember, click on that link below. Comment box. Let us know how we do with these videos. Remember, at the end of the day, you can come on, watch these videos, but they need to also be implemented. So have a great week. We'll see you next week. Thanks.